Hi friends, in the last video we saw what is a health information system. So it is nothing but a software package that is used to collect medical data about the patients, and it is just a package that covers the all the details of the patient regarding the how they register, how we are booking rooms for them, then accounting everything, maintaining the logistics, the pharmacy system, and all the other related systems. Software, that's just a software package that handles everything related to the hospital in a digital format. So when we check what is the health data, like how when we Google about health data, doing projects on healthcare, all we see is the health data is will be mentioned as EMR or EHR, then PHI. So in this video, let us see what is an EMR. Medical records are stored digitally. Normally, they call it as EMR or EHR. These terms are used interchangeably, but there is always a confusion about what is an EMR and what is an EHR. Like both are storing medical records only, but what is the specific difference? Come, let's explore about that in this video. So traditionally, how a doctor records a patient's detail is that they write encounter notes about the patient, how, like, at what time the patient is visiting the doctor, and what the doctor is observing about the patient, what the patient is telling about the complaints that the patient state, and the patient will be saying that they have so many these and these complaints. Then the doctor will be taking some tests to identify the exact problem the patient is suffering from. Then they'll be thinking of a treatment plan, then they'll be giving up medications, and then giving follow-up schedule, everything. So all these things will be recorded in such an encounter note. These will be in a paper and pen format, in paper charts normally in hospitals. We'll be recording all these details in the digital format. So digitally, they are just called EMR or EHR. So talking about EMR, EMR is electronic medical records. These are the records that are shared only within a single specific hospital. So these records store medical data for a patient in only a single facility or a single hospital, that is exclusive to a single doctor. Like take a hospital X, there will be so many doctors working there. So this thing, each doctor will have a login. They'll be recording their the patient details. They are having so these doctors will be storing records of the patient whom they are consulting, and then these records will be exclusive only to the doctor who is checking that particular patient. The main issue with this EMR is that this data can't be shared with other doctors or other lab technicians or anyone outside the institution or anyone outside the hospital. It is exclusive only to the medical record. So it is exclusive only to a single institution. So EMR will contain the doctor's prescription, the X-ray images, then the lab result and everything, but it is restricted to a single doctor or a single institution. So, can you imagine a good situation where EMR portal can be useful? Consider a small a dentist who's having a small clinic, or consider any skin doctor or someone who is doing solo practicing in a single, who is maintaining a solo clinic with some nurses under his control. For his requirement, an EMR portal will be sufficient, because he doesn't want to integrate or share with other doctors. He is controlling everything. He is managing everything. So yeah, an EMR portal will be good for his requirement. So coming these are some free EMR softwares that are available in the market, and then specifically in India, these softwares are all available like Open MRS, Free Med, Open Clinic, Open EMR. In the upcoming videos, we'll try exploring these softwares and check how it works. And talking about before talking about EHR, so these are the common health data that gets stored digitally, like the patient's identifying details like their name, age, sex, address, etc., and their vitals, the height, weight, and their oxygen levels, etc. Then the current medications they are already taking, their history of their illness and the lab reports. along with the discharge summary and their billing details and the insurance details, everything. These will be stored digitally in any hospital, right? So, what is an EHR system? EHR is electronic health record. EHR contains all the medical data that is stored by EMR. In addition, it allows sharing the data with other doctors, sharing the data with other lab technicians, sharing the data with other hospitals. Like if I'm taking treatment in one city in India and if I'm relocating to other city, if both the hospitals that I am consulting they are using a similar EHR portal, then it will be easy for the doctors to share my data among themselves. Right. One another specific thing, another advantage about EHR that uniquely identifies it is that it will have a patient portal. It will have a patient portal. So if I'm consulting a doctor and that hospital is using an EHR portal or EHR software package to maintain their health records, I'll get my own login. I can access my data remotely. I can schedule my appointments online. I can even consult my doctor through email or chat, whatever facility that software provides. So it is very flexible for me. These are the common EHR softwares that are available in the Indian market for free, like Epic and Epic 75 Health, etc. We'll be looking at it in the upcoming videos. I hope you all understood the difference between EMR and EHR. So, EMR is all about storing the medical records of patients, but it will be restricted to a single doctor or a single clinic. They can't share the data. It will be only restricted to that particular doctor who is treating the patient. Meanwhile, EHR is like a package, a complete package. It not only deals with medical data, it also deals with the billing and sharing the data among other hospitals and scheduling appointments, maintain uploading our own records, medical records, document sharing, everything. So that's it for today. Thank you.